Hello, everybody. This is Professor Van Cott coming to you live from my house. This is our first lecture, so I just want to give you a brief overview of the intent of these voiceover PowerPoints. My intent is just to give you some direction on your studying, your reading of what content to focus in on. So I'll go through the PowerPoint. My hope is that these recorded lectures will be anywhere from 15 minutes to a half an hour tops. Again, just to get you focused, and then we'll go back through this at the beginning part of lecture to have discussion, give you a chance to ask any questions. So as you're watching the PowerPoint, maybe take some notes on things that you want more information about, stories that you may want to share with the class. We're a big group of 72, so it'll be hard to get all of that in, and then hopefully we'll have some interactive activities that we can do. So this is your lecture on therapeutic communication. The importance of this is that medical errors are now the third most common cause of death in the United States. That was from a Johns Hopkins study done in 2018. The most common cause of medical errors is poor communication. So it's really important that you learn to communicate effectively. So communication is just a process that information is exchanged. So don't think about just talking to people. It's your body language. It's think about it's any way we exchange information. We use numbers or smiley faces for pain scales to let patients share with us, communicate with us how they're feeling. And it's really important to know your audience. Why do we use those smiley faces with pediatric patients? They may not be able to articulate, or maybe someone with a language barrier. They may not be able to articulate their pain in words to you, but they could point at a face and communicate what they need to. So therapeutic communication is a little different than just chatting with someone, everyday conversation. It's a two-way process. You need feedback from your patient. There's a lot of factors that influence the process. We'll go through all those. But this is your most critical, basic nursing skill, is how to communicate. These just list verbal, nonverbal. So think about, how you're being perceived by your patient. And there's a lot of nonverbal things that go along with that. Forms of communication. Again, like I said, it's not just language. It's the way you present yourself, your appearance, how you're dressed. We will drive this home when you come to lab. Even though we're remote, we're going to ask you to wear your lab coat. If we were in person going to clinical, I'd be looking at, are your fingernails clipped and clean? Is your hair up? Are you dressed neatly and professionally? So, it's really important the way you project and present yourself, that nonverbal communication. Your written, I'm just looking down the list, you can read these yourself, but discharge instructions, be very wary of, not using abbreviations, not using medical jargon. You will understand that once you're a practicing nurse, but does your patient understand that? So is your communication effective for the audience that you're dealing with? So communication in healthcare, we'll focus a little bit more this semester on your communication with your individual patient, but we'll also talk about your interaction with other members of the healthcare team. And, with this communication, you have to really consider your approach. So all these things that you're reading may not be appropriate in certain circumstances. So interdisciplinary communication, again, like I said, those medical errors being the third most common cause of death, and communication being the number one cause of medical errors. Really, really important how you clearly, concisely, effectively share information amongst your team. And really important that you use the expertise on your team. Nursing kind of tends to cross boundaries, so sometimes we forget that we have PT and we have OT. We need to utilize all those experts. So I won't go through all these. You can read this. This is a table cut right out of your book. I'm not sure how you guys are seeing the screen. I have a little picture of myself in the corner. Hopefully that's not blocking you, but if it is, the slide without the voiceover is in your Moodle shell, and you can peek at it in that if I'm blocking the bottom right corner. So basically, with group communication, you really need to value the team rather than individuals. And in any group, there's always dynamics. Think of yourself as being the change in a team, whether it be, you can turn around an unhappy patient, do something that makes them, feel a little bit better, or a hostile workplace environment too. We look at the group dynamics and just how some units, even within the same hospital, one unit from the next is always going to be very different. And sometimes the same unit can be different depending on the members of the team that are there. So that communication, it is communication amongst the team, is important, and it can be steered. You think of yourself as, oh, I'm the new nurse on the floor, but your attitude will go a long way of changing certain circumstances. So the roles of group members, everybody's got a little different role on the unit. Some are focused just on the task. Your nurse manager, if you're the manager, you may be focused on the team as a whole, the group as a whole. The self-serving role never works out real well. I mean, you just think about, for those of you that work in healthcare already, how much it impacts you if someone calls out at the last minute because they went to a great concert last night, and how that affects the whole group. We tend to try to help our team members out. So factors influencing communication. There's so many things. You see this list here that you need to be cognizant of. And there's certainly more details on each of these to follow. Again, you can read the slide, look through your book about, specifics on these things. The next slide will actually show you details about some special populations. Think about Erickson's stage of development, which, by the way, is on slide 36 of this presentation. You'll need that for your therapeutic communication seminar assignment. So these next slides are just about special populations. And again, we'll go into this in class, but there's a lot of different things to consider. Notice we have a whole slide on communication with elder. When we were in the clinical setting, we used to have an assignment that was an interview with an elder adult. The reason why we focus on that is because in the community we live in, largely our healthcare is of an elderly population. We have a very large elderly population. So this is something for you to pay special attention to, only because more than likely this is the population you'll be working with, unless you go into peds or maternity. We are heavy on the elderly population on Cape Cod and the surrounding area. Again, more folks with special needs. And think about some stories that you want to share with the class. This is your class, guys, and the more you get involved in it, the better you'll retain important information. You have something to attach it to. So I really strongly encourage, we'll use on Moodle, or on Zoom, I'm sorry, when everybody's in the lecture, we'll use the hand raise feature, and I'll unmute people so you can share different stories, and I'll have a million stories to share from many years of practice, and even just life experience. Even if you don't have practice experience, think about some things. Even if those communication interactions were outside of healthcare, maybe it went really well and you want to share it. Maybe it went really poorly and you want to share it. So we'll talk about both. I'm gonna scan through these slides, but again, read through them, think about different things that you can share with your peers. We'll also have an opportunity to do smaller groups for those of you that don't like to participate in a large group forum. We'll try to break out and do some activities so that you'll have a chance to participate in a smaller setting. So the helping relationship. Remember, your patient may be depending on you for information. So that unequal sharing of information is, you either have the medical knowledge or at least know where to find it. And it's built on what the patient needs. So a helping relationship or a therapeutic relationship is very different than a friendly relationship with your neighbor or your friend, or someone you run into in the grocery store. You really have a purpose, and you need to impart information on them to them. The helping relationship is also time limited, not just purposeful, but time limited. So remember, you're in a setting, maybe you're in the hospital and you have 5 patients and 8 hours to get a lot of things done. You might be in a long-term care setting and have 40 patients. So, that relationship has to be pretty focused. And also, we'll talk about this more when you get to your legal ethical lecture, but you are professionally accountable for the outcomes. So I'm not quite sure why my feedback slide isn't coming up in its entirety. Let's see. Haha, that's why. So you're important. The purpose is to impart information, not give advice. It describes, doesn't evaluate, focus on the behavior, not the client, and it's specific, not general. So feedback, you should, well, think about, I'm just going to give you a quick example. You should eat bananas with your Lasix. Okay, that's some great advice, I guess, but you're not giving advice. You're trying to give information. So you should eat bananas with your Lasix every morning. Well, what if your patient hates bananas? Maybe saying Lasix will make you lose your potassium through your urine. Do you like bananas or orange juice? You need to replace that potassium. If you can't find a food that that person likes, then you're maybe going to ask the doctor to order a potassium supplement. So, think about that difference between, well, you need to eat bananas, and they don't know why they're eating bananas. You're more giving information, not advice. So the last thing is it's directed towards behavior. The client has the power to change. I think of someone with Tourette's that tends to blurt out swears. They can't change that behavior. However, you could maybe come up with some strategies. Maybe they have a card that they show someone. I have Tourette's. I can't control this, or they learn to say, sorry, I have a medical condition. All right, so factors that promote effective communication. Dispositional traits and rapport builders. I always say leave your personal issues at the door when you go to work. You might have had a fight with your boyfriend and the highway was jam-packed. It took you forever to get to work. You're a little late. We're going to talk about this a lot more in class, and there's more details on the next coming slides. But think about these traits that will help promote effective communication and rapport. So these are some tips about developing conversation skills. You can read through those, but it's seemingly easy, but you need to keep in mind that this is therapeutic communication with a purpose and a limit on the amount of time that you have to impart information and get information from your patient. I like to, be truthful and be knowledgeable. So think about those two. You need to be truthful and admit when you don't know. You can't possibly know anything. We are lifelong learners. Things are changing all the time, and there's such a vast amount of information. So it's okay to say to your patient, geez, I don't know what the side effect of this medication is. Let's look that up. I'll look that up right now for you. That's one thing about communication with your patient. And also keep an open mind with care. You have to consider all the possibilities. We can share a million stories, but I think about a special needs student that was getting, penalized for spitting behavior by the classroom staff when I was a school nurse. So, I started to track it. Well, it was happening every day after lunch. The poor kid had reflux. He wasn't spitting as a behavior. He was spitting because he had horrible acid reflux after he ate. They gave him, I think, Zantac at the time, which isn't around so much anymore, and he was fine. He never spit again. It was not a behavior. We need to think outside of, consider all the possibilities. So again, I'm going to just scan through these different listening skills to develop. You guys can all read these. I won't go through them. Let's talk a little bit about therapeutic touch. This goes a long way, but you need to know, what's your patient's preference. So not all cultures are accepting of touch. So, you need to gauge. It's a wonderful technique to use, but don't assume. You really need to. You'll get a sense as you're in practice of, what's going to work with one patient versus another. This is a fantastic communication technique, but it's not for everybody. So you just need to be mindful. All right, this big, long slide is really important for your assignment. So we'll share lots of examples in class of the different ones and the slides to follow. Have examples of the different techniques. There are also examples and more information in your book about them, but glance through them. Think about if you have any questions, if you're not clear on what one is. These are also things that commonly come up on tests. So make sure you understand what each of those are. Again, too much to go through all of it on this voiceover, but some things are very obvious. Silence, obvious. But if you have certain ones that you want to ask questions on, we'll save that for our live class. These are all just examples. You can pause the recording if you need more time to read them. Gosh, I put a lot of examples in. Okay, so now we're on to blocks to communication. Also important for your assignment, and we'll talk more about this in class. Ditto for what I said on the first long slide. Just read through them and see if you have any questions on certain ones. More blocks to communication. We'll put this in action and you'll have a good grip on what all of these are. So the clinical interview. So like we said before, avoid advice. I'm just going to pull up all of these. Keep the focus on the client. You might have had a great date the night before, but not the time and place to share that information. Sometimes you might share a little bit of information, though, to let your client open up and make them more comfortable around you. So you really have to gauge what you're sharing with the client and why, all of your communication. Why are you doing what you're doing? I don't know if there's one more on here. So again, that avoid advice thing is huge for us, especially when you're first into practice. And thinking about healthy ways to meet your needs of your patients, like saying you really should lose 30 pounds versus saying, a healthy weight for your stature is 180 pounds. How do you think you can change your diet? What's your diet like? And then go from there. And let's talk about some options for exercise. Rather than saying, you need to lose 30 pounds, you really have to start exercising. And it's a whole different vibe to the conversation. So a process recording, this is something that we are going to use throughout the whole program, your 2 years with us. We'll do a little bit of a process recording in the therapeutic communication assignment. You'll do more to follow throughout the course, so just something to get used to. And when you get into practice, you're not formally writing this stuff down, but you're constantly doing process recordings. And it's just a way to analyze how things went down. Okay, what might have been what did the patient say? You know, what was their body language and their demeanor, and what did you say back to them? And gosh, I realized I was standing at the door with, you know, one leg half out the door, my hands on my hip. I was in a rush. They might have thought I was shouting because I was, you know, on my way to some other issue. And you want to analyze what went down and why things might have had the outcome that they did. And so for the exercise, we're going to look at how things can go poorly and how to turn that around and make them go well. When you get into practice, you're probably only going to really analyze things that didn't go so well, so you can do it differently the next time, or share things that did go well with your colleagues so they know how to approach. When you're giving report, you might say, you know, oh boy, you know, bring up, this is what the patient did for work, and they're really, you know, that's a great connection with them. Or the patient's wife comes in every day at noon, and, you know, you can remind them of that, and that'll put them in a great mood. Things like that. So things that go well and you want to share, you know, you're just kind of doing that on the fly, but it's a skill that you have to get used to doing. So we do it a little more formally in class. Okay, remember I said slide 36, Erickson stages of development. You'll review these for your assignment. This chart tells you everything you need to know about Erickson's, and it's in your book too. So, and then the last thing, again, we will do in class, lab, or clinical, wherever we have time, we will do an SBAR processing, and I have articles that we can read about it in clinical. But this will just give you a little bit of an overview of it. Just glance through this so you have some base of knowledge of what SBAR communication is. This is the most common tool used for interdisciplinary communication. Doctors are very appreciative of it when you offer information in this format. There are other tools that we use, so we'll go more into that with lab and clinical this week. So, all right, I went over my 20 minutes by 8 minutes. That will conclude our quick voiceover PowerPoint, and be prepared when you come to class to share some stories and have discussions about this. Have a great day, everybody.